August 17, 1945. A surgical room in Hawaii still smelled of war. Nurse Yuki Matsumoto scrubbed her hands, staring through the doorway at the operating table where a young Japanese soldier lay dying, his legs shattered beyond recognition. She'd been taught that Americans butchered enemy prisoners to save morphine. Fast amputations. No mercy for the defeated. But then Dr. Chen walked in, studied the x-rays, and said something that stopped her heart. "We're going to try to save it. 10 hours of surgery. For an enemy." And when she learned that Dr. Chen had lost 30 relatives to the Japanese army in Nanking, she realized he had every reason to let that blade slip. But he didn't. He stayed. And fought for a stranger like he was family. This wasn't supposed to happen. But if you want to hear more incredible, untold stories that challenge everything you thought you knew about history, hit that subscribe button and drop a comment telling me what city you're watching from. I love seeing how far these stories reach. Retry. The chlorhexidine stung Yuki's cracked skin as she scrubbed her hands for the third time, watching the pale yellow liquid swirl down the drain. Through the doorway of the surgical prep room, she could see Corporal Hayashi on the operating table, his right leg elevated and wrapped in temporary dressings that barely concealed the horror beneath. The swelling had turned the skin a mottled purple-black from knee to ankle, and even from this distance she could see where white bone had punctured through near the tibia. The compound fracture had happened 3 days ago during transport from the prison camp. A stupid accident involving a truck and a pothole that should have been nothing more than a jarring bump. But infection had set in fast, the way it always did in the tropical heat, and now the leg had that particular smell that every battlefield surgeon recognized. The smell of tissue dying from the inside out. The air in the prep room carried the sharp bite of ether mixed with iodine, a combination that had become so familiar to Yuki over the past 4 years that she barely noticed it anymore. An American lieutenant whose name she had not caught handed her a pair of surgical gloves without making eye contact. His hands were steady and professional, his face blank in that way medical personnel learn to wear like armor. He gestured toward the operating theater and said something in English that she parsed slowly, her limited vocabulary catching on every third word. "Dr. Chen, lead surgeon, you assist." She nodded once, the way she had been trained to acknowledge orders without question. She expected this to be quick. She had assisted in 42 amputations on Saipan, most of them performed in under 20 minutes because morphine was precious and speed meant fewer men screaming. The Imperial Army had taught her that sentiment was a luxury the losing side could not afford. You assessed the damage, you made the cut, you cauterized and moved to the next patient. Efficient. Clinical. No room for hope, when hope only prolonged suffering. She had learned to think of mangled limbs the way you thought of spoiled food, something that had to be removed before it poisoned the whole body. Corporal Hayashi was young, maybe 21, but that did not matter. The leg was doomed. Better to take it now and give him a chance at survival than to waste resources chasing miracles that did not exist. Dr. Chen entered the surgical theater while she was still pulling on her gloves. He was younger than she expected, perhaps mid-30s, with Chinese features and wire-rimmed glasses that fogged slightly from the heat of his surgical mask. He moved with the deliberate calm of someone who had done this 1,000 times, crossing to the light box where X-rays of Hayashi's leg were clipped in a neat row. Yuki watched his eyes as he studied the films, looking for the signs she had been trained to recognize in enemy doctors. Cruelty, impatience, the cold calculation of someone who saw prisoners as less than human. Her commanding officer on Saipan had warned her repeatedly about American savagery, about the white devils who tortured captured soldiers for sport, who felt no obligation to honor the conventions of civilized warfare. She had believed him because she had no reason not to, because everything she had ever been taught said that surrendering to the Americans meant suffering worse than death. But when Dr. Chen turned from the X-rays and addressed his surgical team, his voice was quiet and steady, absent of anything that resembled hatred. He spoke in English, words tumbling too fast for Yuki to catch most of them, but then he said something that cut through her limited vocabulary like a blade through silk. "We're going to try to save it." She stared at him, certain she had misunderstood. Save? Not amputate? Her hands froze halfway through adjusting her surgical mask. Dr. Chen continued speaking to his team, his tone matter-of-fact but edged with something that might have been determination. 10, maybe 12 hours, he said, and those numbers Yuki understood perfectly well. Compound tib-fib fracture, vascular compromise, risk of sepsis, but he's 21. The words came slower now, as if he were choosing each one with care. If we take the leg now, he goes home broken. If we fight for it. He did not finish the sentence. He did not need to. The implication hung in the air like the smell of ether, impossible to ignore. Yuki felt something crack in her chest, some carefully maintained wall that had kept her functioning through 4 years of war. This did not make sense. Prisoners were a burden, resources were limited. 10 hours of surgery for an enemy soldier was not just generous, it was irrational. It violated everything she understood about military medicine, about triage, about the cold mathematics of war that said you saved your own first and let the enemy fend for themselves. She had watched 37 patients die on Saipan when the supplies ran out, had stood beside their cots and done nothing because there was nothing to be done, because the rules said you did not waste resources on lost causes. As the surgical team began their final preparations, Yuki noticed something that made her hands start to tremble inside her gloves. Dr. Chen's hands were shaking too. Not much, just a faint tremor as he reached for his first instrument, but enough that she recognized it immediately. Not incompetence, not fear, restraint. The kind of shaking that came from holding something back with every ounce of strength you possessed. A nurse moved close to another team member, their voices dropping to a whisper, but the surgical theater had strange acoustics and Yuki heard every word. Doc lost family in Nanking, Jap army, this is hard for him. The breath went out of Yuki's lungs. 30 relatives, she would learn later. 30 people erased by the same army she had served. This man had reason. He had justification. The Geneva Convention allowed triage decisions. No one would question him if he simply shook his head and reached for the amputation saw. No one would call it murder if he decided the leg was too far gone, if he chose the quick and easy path that would end this in 30 minutes instead of 10 hours. But he was not reaching for the saw. He was studying the X-rays one more time, his jaw set, his hands steadying as he made his choice. Yuki realized with a clarity that felt like ice water that the propaganda had been wrong. But if it had been wrong about this, what else had been a lie? Kenji floated in and out of consciousness like a man drowning in warm water, the ether pulling him down into dreams that felt more real than the operating table beneath him. In one moment he was lying under bright surgical lights with strangers cutting into his leg, and in the next he was standing in his mother's kitchen in Hiroshima, watching her hands fold his Imperial Army uniform with the careful precision she brought to everything she touched. The smell of miso soup filled the small space, rich and comforting, mixing impossibly with the sharp chemical scent of whatever they were using to keep him under. His mother's face was exactly as he remembered it, lined with worry but determined not to show it, her lips pressed into that tight smile she wore whenever she was trying to be brave. "Come home with honor," she had said the morning he shipped out, her fingers smoothing the collar of his uniform one last time. "Come home with honor or don't come home at all." But he had not come home with honor. He had surrendered. The word tasted like bile, even in his dreams, a betrayal so fundamental that it rewrote everything he thought he knew about himself. Dishonor. The shame of it sat in his chest like a stone, heavier than the pain in his leg, heavier than the fear of dying on this table surrounded by enemies. His training sergeant had been clear about what happened to soldiers who surrendered. You became Kichigai, a disgrace to your family, a stain that could never be washed clean. Better to die fighting. Better to die by your own hand. Better anything than to let the enemy take you alive and turn you into proof of Japanese weakness. The ether dragged him back toward the surface, and he became aware of voices speaking in English, low and urgent, words he could not understand but tones he recognized from every surgery he had ever witnessed. Controlled crisis. Barely managed chaos. Someone was counting in a steady rhythm, and he realized after a moment that it was his own heartbeat they were tracking. The beep, beep, beep of a monitor that seemed impossibly loud in the small spaces between dreams. He tried to open his eyes, but his eyelids felt like they belonged to someone else, heavy and uncooperative. The pain in his leg was distant now, pushed down under layers of medication, but he could still sense it lurking there like an animal waiting to pounce the moment the drugs wore off. In another lucid moment, he managed to focus his eyes enough to see the surgical team moving around him with practiced efficiency. There were 6 or 7 people in the room, all wearing masks and caps that made them look identical except for their eyes. One pair of eyes belonged to a woman, and something about the shape of them, the way they crinkled slightly at the corners, made him think she might be Japanese. He watched her hold a metal instrument steady while the lead surgeon worked, her hands not shaking at all, despite what must have been considerable strain. Her eyes were wet behind her mask, and he wondered if she was crying or if it was just sweat from the heat of the surgical lights. She glanced down at him, and their eyes met for half a second before she looked away, but in that brief moment he saw something that confused him. Recognition, sympathy, maybe even guilt. She whispered something in Japanese, so quietly he almost missed it. Ganbat, hang on. The words pierced through the ether fog like a knife, sharp and impossibly clear. He wanted to ask her why she was helping them, why she was working alongside Americans to save the leg of a prisoner who by all rights should be left to die, or at least left to suffer the consequences of his own surrender. His training had been explicit about this. Enemy wounded were a liability. They slowed you down. They consumed resources. They complicated logistics. His own officers had taught him that mercy on the battlefield was just weakness in disguise, a sentimental attachment to individual lives that betrayed a failure to understand the larger strategic picture. You did not waste surgical time on enemy combatants when your own soldiers needed care. You certainly did not invest 10 hours in trying to save a limb that could be removed in 30 minutes. But here they were, hours into a surgery that made no tactical sense, and this woman who spoke his language was telling him to hang on. The heart monitor kept its steady rhythm, and he focused on that sound, using it to anchor himself when the dreams tried to pull him back under. Beep, 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 proof that he was still alive, proof that someone was working very hard to keep him that way. He could smell cauterized flesh now, that particular burned meat odor that every soldier recognized, mixing with the ether and the antiseptic and something else he could not identify. His own fear, maybe, or theirs. The woman's voice came again, counting in Japanese this time. Instruments, he realized. She was counting surgical sponges to make sure none got left inside him. The precision of it struck him as absurd. They were treating him like he mattered, like his life had value, like the fact that he wore an enemy uniform was somehow less important than the fact that he was 21 years old with a shattered leg and a family back home who would never forgive him for surrendering but who probably still loved him anyway, in that complicated way that families loved their disappointments. He wanted to understand why they did not just let him die. It would be easier, faster. No one would blame them. His own side had written him off the moment he let himself be captured. The Americans owed him nothing, less than nothing given what his country had done to theirs. But instead of abandoning him, they were surrounding him with machines and monitors, with skilled hands and careful attention, with hours of painstaking work that his ether-soaked brain could not quite process. His throat would not work when he tried to form words, would not let him ask the questions that crowded behind his teeth. So he lay there and listened to the beeping and the quiet voices and the woman counting in 2 languages, and he wondered if this was what mercy looked like when you had been trained your whole life to expect cruelty. Frank Chen's fingers had started to ache around hour 5, that deep bone-tired pain that came from holding delicate instruments in precise positions for longer than human hands were meant to endure. His lower back screamed every time he shifted his weight. The muscles knotted from bending over the operating table at an angle that would have made his anatomy professors wince. But he kept going because stopping meant giving up, and giving up meant that the last 5 hours had been for nothing. The tibial artery was more damaged than the X-rays had shown. The vessel walls torn and ragged in a way that suggested the fracture had done its damage slowly, grinding bone against soft tissue until everything inside was compromised. He could see now why another surgeon might have looked at this mess and reached for the amputation saw. It would be defensible, reasonable even. No one could fault him for making the pragmatic choice. But Frank had never been particularly good at pragmatic choices, not when a patient's future hung in the balance. He worked with methodical precision, his hands moving through the familiar choreography of vascular repair, even as his mind wandered to places he tried very hard not to go. Nanking, 1938. He had been 14 years old, still living in Shanghai with his parents, still receiving regular letters from his uncle's family across the river. Then the letters stopped. For months his mother had made excuses, blaming the postal service, blaming the chaos of war, blaming anything except the truth that they all knew but could not say out loud. It was a Red Cross worker who finally told them, a tired woman with kind eyes who sat in their cramped apartment and explained that 30 relatives were gone. Just gone. No bodies to bury, no graves to visit. Nothing left except silence where voices used to be. Frank looked down at Corporal Hayashi's face, slack and peaceful under anesthesia, and saw someone's son. The resemblance to his own cousin was superficial at best, just the same general age and build, but it was enough to make his chest tighten. This boy was 21. His cousin would have been 27 now if he had lived. Frank wondered if his hands would have shaken like this if he had been asked to operate on the men who killed his family. If he could have maintained this same careful composure while cutting into the flesh of someone who wore the same uniform as his cousin's murderers. He liked to think he would have. He had taken an oath. But oaths were easy to swear and harder to keep when your grief had faces and names and empty chairs at family dinners. The Japanese nurse, Yuki, had been holding the retractor steady for 3 hours without complaint. Frank glanced up at her and saw the strain in her shoulders, the way her arms trembled slightly from the sustained effort of keeping the surgical field open. She had to be exhausted. They were all exhausted. But she had not asked for a break and he had not offered one because they both understood that momentum mattered in a surgery like this, that stopping meant losing the thread of what they were building. Her eyes met his over the patient's body, and he saw something there that surprised him. Not hostility, not even resignation. Just a kind of fierce determination that matched his own, as if she had decided somewhere along the way that this surgery was going to succeed, and she would hold that retractor until her arms fell off if that was what it took. He tried to think of something to say that might acknowledge her effort without breaking his concentration. The English came first, automatic and simple. "You're doing good." Then he reached for the Japanese he had learned as a child from his grandmother, words that felt clumsy in his mouth now after years of disuse. Yoi shigoto. Good work. He was not sure if he had pronounced it correctly, if the tones were right, or if he had accidentally said something completely different, but Yuki's eyes widened slightly, and he saw her posture shift just a fraction. Not quite a smile behind the surgical mask, but something close. A tiny crack in the wall that separated enemy from colleague, prisoner from person. The moment passed and Frank returned his attention to the artery, his fingers working with practiced efficiency to place sutures that would hold without restricting blood flow. The surgery was a puzzle, and he was good at puzzles, had always been good at seeing how broken pieces could fit back together if you were patient enough and careful enough, and willing to try 15 different approaches until you found the one that worked. Around hour 7, the pieces finally started to align. He stepped back and watched as blood flow restored itself, the pale tissue below the knee slowly turning pink as circulation returned. The pulse in the foot was weak but present, a steady throb under his fingertips that felt like a small miracle. The nurses made soft sounds of approval, their relief palpable even through their professional composure. Frank allowed himself one deep breath, the first moment in hours where he thought they might actually pull this off. But medicine had taught him not to celebrate too early, and his instinct proved correct when the temperature alarm on the monitor started beeping around hour 9. Frank looked at the readout and felt his stomach drop. 104 degrees Fahrenheit and climbing. Fever that high meant only one thing. He pulled back the surgical drapes and saw what he had been dreading, the telltale signs of gas bubbling under the skin near the wound site. Clostridial infection. Gas gangrene. The words felt like a death sentence even before he said them out loud. The operating room went cold. Lieutenant Morrison, the head surgical nurse who had been his right hand through a dozen impossible cases, said what everyone was thinking. "Frank, if we don't amputate now, it'll spread. He'll die." Her voice was gentle but firm. The voice of someone who had seen this scenario play out too many times to pretend there were good options left. This was the moment, the easy out, the choice that would let him walk away with his conscience intact because he had tried, because no one could say he had not given this young man every chance. 9 hours of work would be lost, but the patient would live, and living with one leg was better than dying with two. Frank stared at the wound, at the hours of meticulous reconstruction that were about to be rendered meaningless by microscopic bacteria, at Kenji's face still peaceful and trusting under the anesthesia. He thought about his 30 relatives who never got a second chance, who never got mercy or choices or skilled surgeons fighting for their lives. He thought about his oath and what it meant to really mean it, not just when it was easy but when every fiber of his being wanted to give up. His voice cracked when he finally spoke. "We debride. Aggressive. High-dose penicillin. We bought him 9 hours. We can buy him one more." Yuki watched the temperature climb on the monitor and felt something cold settle in her stomach. The same sensation she used to get on Saipan when a patient's breathing changed in that particular way. That meant you were about to lose them. 104.3 degrees now. The infection was moving fast, faster than antibiotics could catch it, blooming through tissue that had already been traumatized by hours of surgical manipulation. She could see the gas bubbles forming under the skin near the incision site, tiny pockets of bacterial waste that pushed the flesh up in ways that flesh was never meant to move. Clostridial infection was a death sentence in most cases. She had seen it kill strong men in less than 24 hours, watched the necrosis spread from a wound site to major organs, while doctors stood helpless because there was simply nothing to be done once the bacteria got that kind of foothold. Lieutenant Morrison's voice cut through the surgical theater with the kind of authority that came from years of watching doctors make bad decisions and having to live with the consequences. "Frank, if we don't amputate now, it'll spread. He'll die." The words hung in the air like a challenge and a plea combined, the voice of pragmatism trying to save a surgeon from his own stubborn hope. Yuki had heard similar words on Saipan, usually right before a commanding officer overruled a junior doctor's optimism and ordered the merciful cut that would at least preserve life, even if it destroyed quality of life. She had learned not to argue with those decisions because arguing meant showing attachment, and attachment was weakness, and weakness got you assigned to the patients no one else wanted to treat. But Dr. Chen did not reach for the amputation saw. He stood there staring at the wound with an intensity that made Yuki think he was having a conversation with himself, weighing options that the rest of them could not see. His jaw was tight behind the surgical mask, and his hands had gone very still, that particular stillness that came right before a decision that could not be unmade. Yuki held her breath without meaning to, her arms burning from holding the retractor in position for what felt like a lifetime. 9 hours of work sat in front of them, 9 hours of painstaking reconstruction that had seemed miraculous just 30 minutes ago and now looked like wasted effort. The pragmatic thing would be to cut the leg, the safe thing, the thing that would let everyone walk away knowing they had tried their best but biology had simply won. Dr. Chen's voice when he finally spoke was rough with exhaustion and something else, something that sounded almost like anger except it was not directed at anyone in the room. "We debride. Aggressive. High-dose penicillin. We bought him 9 hours. We can buy him one more." The statement landed like a stone in still water, sending ripples through the surgical team. Lieutenant Morrison opened her mouth to argue, and Yuki saw the calculation happening behind her eyes. The mental math of risk versus reward, of surgical resources versus probable outcomes. This was not a safe choice. This was not even a particularly smart choice. This was a surgeon deciding that 10 hours was not enough, that they had come too far to quit now, that one more hour might make the difference between a young man walking again and a young man going home with an empty pant leg and a lifetime of phantom pain. Morrison tried one more time, her voice softer now, almost pleading. Frank. Just his name, nothing else, but the weight of all her years of experience was packed into that single syllable. Yuki understood what she was really saying. I don't want to watch you destroy yourself over a patient you can't save. I don't want to stand here for another hour and then have to amputate anyway while you hate yourself for wasting time we didn't have. I don't want this boy to die on our table because we were too proud to make the hard call when we had the chance. But Dr. Chen shook his head, and his voice cracked in a way that made Yuki's throat tighten. I'm not giving up on him. The pause stretched out for 3 heartbeats. Not when we're this close. He looked around at his surgical team, meeting each person's eyes in turn, asking without words if they were willing to follow him into one more hour of probably futile effort. The anesthesiologist adjusted something on the ventilator. The surgical assistant reached for fresh instruments. Morrison closed her eyes for a long moment and then nodded once, a gesture of surrender that was also somehow a vote of confidence. They were staying. They were fighting. Yuki felt something break open in her chest, some carefully maintained barrier between the soldier she had been trained to be and the nurse she had wanted to become before the war taught her that wanting things was dangerous. In the Imperial Army, surgeons gave up when morphine ran low. They gave up when the odds dropped below 50%. They gave up when headquarters sent orders to move out and leave the wounded behind because the Emperor's strategic objectives mattered more than individual lives. She had participated in that calculus, had helped decide who got the last doses of antibiotics and who got moved to the tents where they kept the dying comfortable until they stopped breathing. She had told herself it was necessary, practical, the only way to function in a war where resources were finite and suffering was infinite. But this man was fighting for an enemy soldier like he was family. This man had lost 30 relatives to the same army that had trained Corporal Hayashi to kill without question. And instead of letting that history guide his scalpel toward vengeance or indifference, he was choosing to spend hour 10 of a surgery that should have ended in hour 1. Yuki thought about every lesson she had been taught about American cruelty, about their lack of honor, about how they treated prisoners like animals because they did not understand Bushido or duty or the value of a warrior's death. Every single lesson felt like ash in her mouth now. This was not cruelty. This was not dishonor. This was something she did not have words for in Japanese or English, something that sat outside the vocabulary of war and propaganda. The debridement was brutal and necessary. Dr. Chen cut away infected tissue with swift precision, removing anything that looked compromised, anything that might harbor the bacteria that were trying to kill their patient. The smell was worse now, the sweet, sick odor of gangrene mixing with cauterized flesh and antiseptic. Yuki's arm shook as she repositioned the retractor to give him better access to the wound. She wanted to pray, but she had stopped believing in gods. Somewhere around patient number 23 on Saipan, a boy of 19 who had asked her to tell his mother he died bravely when they both knew he had died, crying for water that they did not have to give him. But now, watching Dr. Chen fight for a stranger with the same intensity she imagined he would fight for his own brother, she found herself whispering prayers to deities she no longer trusted. Please, please let this work. Please let mercy be enough. Kenji woke 3 days after the surgery to white walls and a ceiling fan turning lazy circles overhead, the blades moving just fast enough to push warm air around the recovery ward without actually cooling anything. For a long moment he could not remember where he was or why his entire body felt like it had been taken apart and reassembled incorrectly. Then the pain in his right leg announced itself with clarifying intensity, and everything came rushing back. The truck, the pothole, the fracture, the operating table. The certainty that he would wake up with one leg or not wake up at all. He held very still, afraid to look down, afraid to confirm what he assumed must be true. They had taken it. Of course they had taken it. That was what you did with ruined limbs. You cut them off, and you moved on. But when he finally gathered the courage to lift his head from the pillow, he saw his legs still attached to his body. Both legs, in fact, though the right one was wrapped in bandages from knee to ankle and elevated in some kind of metal sling contraption that held it at an angle he could not have managed on his own. He stared at it for a long time, trying to understand what he was seeing. The leg was still there, swollen and immobilized and clearly in bad shape, but there, present, not amputated. He did not know what to do with this information. It did not fit into any framework he had been given for understanding how enemies treated each other, how resources got allocated, how the cold mathematics of military medicine worked. Yuki sat in a chair beside his bed, her posture perfect even in exhaustion, and he realized she must have been there for a while. She looked different without the surgical mask, younger and more tired at the same time, her face carrying the kind of weariness that came from weeks of inadequate sleep rather than just one hard shift. When she saw he was awake, she leaned forward and began speaking in Japanese, her voice soft and careful like she was talking to someone who might break. She told him about the surgery, about the 10 hours, about the infection that had nearly killed him and the decision Dr. Chen had made to keep fighting when everyone else thought it was over. Her words came slowly, each sentence a small gift of information that Kenji's morphine-fogged brain struggled to process. "The infection is clearing," Yuki said, translating Dr. Chen's assessment from rounds that morning. "You'll walk again, with a cane, maybe a brace, but you'll walk." Kenji felt something hot and painful build behind his eyes, tears that he could not stop even though crying was weakness, even though men in his position were supposed to bear suffering in silence. But no one had taught him how to process mercy. No one had given him a framework for understanding why strangers would spend 10 hours saving the leg of a prisoner who by all logic should have been written off as a resource drain. His training had covered interrogation and deprivation and the various cruelties he might face as a captive. It had not covered kindness. He had no defense against it. Dr. Chen appeared during afternoon rounds, moving through the recovery ward with the unhurried competence of someone who had done this walk 1,000 times. He looked exhausted, his eyes bloodshot behind wire-rimmed glasses, but he came to Kenji's bedside himself instead of delegating to a subordinate. He checked the vitals chart hanging from the foot of the bed, adjusted the leg sling slightly to improve the angle, made notes on a clipboard in handwriting too small for Kenji to read. Yuki translated his medical assessment into Japanese, her voice taking on a formal quality that suggested she was trying to convey not just the words, but the tone of professional care behind them. Everything was healing as well as could be expected. The infection was responding to antibiotics. Physical therapy would start in a week if the swelling continued to go down. Kenji managed one word in English, the only question that mattered. Why? His voice came out rough and uncertain, shaped wrong by a throat that had spent 3 days intubated. Dr. Chen paused in his note-taking and looked at him directly for the first time, really looked at him, and Kenji saw something in that gaze that he could not name. Not pity, not anger. Something quieter and more complicated. Frank removed his glasses and cleaned them slowly with the edge of his white coat, a gesture that seemed more about buying time to find words than about improving his vision. When he spoke, his voice was soft enough that Kenji had to strain to hear it even in the relative quiet of the recovery ward. "Because the war is over." The simple statement hung in the air between them. And if we don't show each other mercy now, what did any of it mean? Frank did not mention Nanking. He did not mention the 30 relatives whose names Kenji would never know, whose deaths had carved a hole in this man's family that could never be filled. He did not have to. The restraint itself was the answer. the choice to treat an enemy with the same care he would have given to his own brother. Kenji understood in that moment that mercy was not the absence of anger but the decision to act against it, to choose healing over vengeance even when vengeance would have been justified. He did not have words for what he felt, not in Japanese or English, but his chest ached with it. 2 weeks later, Kenji took his first steps, 12 feet down the recovery ward, one hand gripping a wooden cane that the physical therapist had adjusted to his height, one hand wrapped around a parallel bar that ran the length of the therapy area. Every muscle in his right leg screamed in protest, and his knee threatened to buckle with each weight transfer. But he kept going because stopping meant letting them down, meant wasting the 10 hours they had spent fighting for this moment. Sweat ran down his face and his breathing came harsh and uneven, but he made it to the end of the parallel bar, 12 feet that felt like 12 miles. When he turned around, he saw Dr. Chen watching from the doorway, arms crossed, expression carefully neutral in that way doctors had when they were trying not to show how much a patient's progress meant to them. Kenji released his grip on the parallel bar and bowed, the movement shallow and painful but deliberate. The bow said what his broken English could not, said, "Thank you, and I'm sorry, and I don't understand why you did this, but I will spend the rest of my life trying to be worthy of it." Frank bowed back, a gesture that looked awkward on an American but carried its own weight of respect. Yuki watched from the corner of the therapy room, tears streaming down her face openly now, past the point of caring who saw her cry. She thought of every lie she had been taught. Americans torture prisoners. They have no honor. They are beasts who cannot recognize human dignity when they see it. Every word felt like poison she had swallowed without questioning. Propaganda that had shaped her understanding of the world until the world itself proved the propaganda wrong. That night, Yuki wrote a letter she would keep for 50 years, never sent but always carried, folded in her wallet beside a faded photograph of the surgical team. "To my future children," she wrote in careful characters, "I watched an enemy save an enemy. I watched hate choose mercy. I learned that the rules we're taught can be wrong, but the rules we choose, to heal, to try, to see the person, those are the ones that make us human." She did not know if she would ever have children to read these words. She did not know if she would survive the complicated process of repatriation, of returning to a Japan that would view her surrender as shame. But she wrote the letter anyway because some truths needed to be preserved, needed to be remembered, needed to exist as testimony that mercy had happened here.